Similarly, today, I am seeing more and more doctors and really serious treatment places use um, microdosing to help out, whether it's depression or anxiety, PTSD, and pain, as a matter of fact, as well. Let's jump in a little bit to some things that I know that you have expertise in, like ketamine for depression. Maybe it's psilocybin or anything else, and paint me a little bit of a picture of what I see right here in your, as we introduce you, natural alternative psychiatry.
Well, the easiest way to understand that is medicine is not above fashion. It's not above what the public believes, what the public demands. I am old enough to remember the 60s when a lot of people were talking about hallucinogens. And we largely disregarded hallucinogens in medicine. And we thought there was a war on drugs and one doesn't take such things. And now we know a great deal more thanks to some very dedicated people who have been working continually since then. I literally just recently finished reading a very serious textbook of psychedelic medicine. And psychedelic medicine exists for a few people in universities who have managed somehow to get permission from the government to take substances that generally would not be allowed and to study them. And the bottom line is the reason that now I'm devoting myself so completely to this field is that the truth of the matter is it looks as if, as a group, so-called psychedelic drugs or hallucinogens can lift depression faster than any of the FDA-approved drugs. And instead of talking about 30, 40, 50% getting better at the end of 4 or 5 weeks, we're talking about figures more around 70 or 80%, feeling something good and not depressed after an initial exposure of several hours.
Hello and welcome to another exclusive interview by Recovery Today Magazine and Recovery Today Podcast, where first and foremost, we're Magazine Hope. Whether you're considering addiction recovery for yourself or loved one, or maybe you've been in recovery a little while or a long, long time, you're going to find all kinds of topics related to addiction, recovery, and really living a happy and successful, sober life in Recovery Today. My name is Rob Hanley. I'm the editor-in-chief of Recovery Today, and with no exception, joined by another really, really amazing guest. I love to interview guests, which is most everybody that is much, much, much smarter than I am. My guest today is an MD and a board certified psychiatrist in private practice in San Diego, California. She's involved in research to determine the safety and efficacy of treatment with natural substances. A native of Boston, she graduated from medical school in France, and after returning to the U.S., did her internship in general surgery and residencies in neurosurgery and psychiatry. She also has done fellowships in neurology and psychopharmacology. She calls her current practice natural alternative psychiatry and chiefly concentrates on transitioning patients away from prescription drugs and into natural substances. My guest today is Dr. Estelle Goldstein. Doctor, thank you for taking a minute to jump on.
You're very welcome. It is a delight to be here. And these are wonderful folks I will love talking to because people in recovery are so precious.
You know, and the thing is, too, is I want to talk a lot about co-occurring disorders such as depression and anxiety and PTSD and other things like that, because all of these things are all really tightly wound together. But the thing that really I find so cool about what you do is the whole idea. I don't like dogma where everybody goes down one single way. There's one way to do anything. And at Recovery Today, we're very, very open. We always say we don't really care how you lead a happy, successful, sober life, a life, free of anxiety to the most part, or free of depression to the most part. Don't really care how you get there, just that you actually arrived. And it's obviously it's not a delusion of some kind. So take me a little bit through into how you became interested through your experiences in neurology and psychopharmacology into this natural alternative psychiatry and the idea of using natural substances instead of prescription drugs.
Well, it's an idea that came upon me pretty slowly, and I guess it became progressively apparent that it's not a secret anymore, but we don't know exactly what we're doing. You can't be very dogmatic unless you think you have a unique handle on the truth. And heaven knows I've never had that kind of feeling dealing with psychiatry. I've been involved in it so long. I started in neurosurgery and neurology because it is very, very tempting to think of the brain as something we know about, that we know about specifically, like what chemical is doing what at what structure, and you can correct that. I wonder if that isn't delusional. All of the diagnostic and statistical manuals, and the very first one came out as far as I know, in 52, the year before I was born. Yes, you all know my age now. They're descriptive. A bunch of academic people who work for universities and are trying, I believe, sincerely and honestly, to get a close handle on the truth, get together nationally or internationally in a room and discuss what everyone with a certain diagnosis looks like, the externals. And you come up with lists that are 3 of this list, 2 of this list, 1 of that. Subtract 7 and you get a magic number, and this is the drug you should give. And it just isn't that simple. The progression of psychopharmacology has been a series of extremely fortunate errors. Extremely fortunate. Like, again, before I was born, when people were treating tuberculosis and everyone was in an asylum in upstate New York and getting the latest antibiotic, someone went in to photograph them, and they noticed more than any doctor could, they were happy, they were jumping around and doing something like a can-can. And that's where we got the first antidepressant.
Really? The first
Imipramine, the first antidepressant, was just a simple derivation from an antibiotic.
That's amazing. I have never heard that.
Well, I don't think anyone else is proud of it, because if anyone were to say this is the birth of my specialty, you would have to admit that it came about by a series of accidents. And since then, accidents have abounded. But the accidents have been intermittently arranged with Me Too phenomenon. Like, you seem to discover that one thing will work, and you may take some dangers and risks with a drug to get it, and it's rather complex. Like, I remember, I'm old enough so that I knew people who were strict Freudians, didn't think you should use drugs. People who used the very first drugs, they were difficult to use. You didn't want to give someone more than a week's worth at one time, or else, heaven forbid, they could harm themselves had they that intent. And sometimes depressed people do. So it was quite difficult. Then the next kind of advances came. To most people, the hallmark was fluoxetine, Prozac, the selective serotonin reuptake inhibitors, and they worked only on serotonin. Now, of course, there were natural substances that, about 20 steps ahead in the synthesis of serotonin, that you could take without any difficulty, and they make more serotonin in your body.
And what would those be? What are those?
5-HTP, 5-hydroxytryptophan,
Yeah.
which is something you can get in any drugstore and in most department stores. You buy it off the shelf,
Yeah.
and maybe $5 or $10 for a couple of weeks worth, and that's it. So that would produce a similar thing. But medicine is more complicated than this, because not everyone with depression fits even the descriptive criteria. There are lots of medical diseases that you can have.
Yeah. And then
Uh,
there's also the whole idea too that there's also a whole idea too that you should be depressed. You have some kind of catastrophe that happens in your life. There's some kind of a tragedy. A loved one dies or has a car accident or something like that. Um, you're supposed to be depressed. You're supposed to be, for some period of time. How long is it generally until it's gone too long, and until what how long is too long on something like that, by the way?
it's very hard to define. There are adjustment disorders which were benign and don't require specific treatment and may take just a couple of weeks. A person doesn't necessarily have to be depressed, because the signs they came up with, the academics in all those rooms, are what they call neurovegetative or bodily signs. Either you're tired all the time, or so nervous you can't sleep at all, or you sleep all day, or you eat so much you gain weight, or you have a horror of food and you start getting anorectic. They can be so many different extremes, they seem to be mutually exclusive. Now, an outside phenomenon certainly can start a depression. It depends on your individual threshold. It depends on the chronic nature or the acute nature of the stress. There are as many different stories and as many different brains and sets of biochemical brain substances as there are people. So that's why we have to admit we're an imperfect specialty still, and have to treat people with a lot of love and caring.
So my thought a little bit, and we like to push the envelope here. Most of the articles that we have that are within recovery today, most of the content is what I would call traditional, more traditional 12-step based type of type of content. But again, we don't care how you actually are able to turn your life around. And years back, probably 6 or 7 or 8 years ago, we started talking about CBD. And I remember being very concerned at what our audience would think about, CBD, because are you telling people to smoke pot and this and that and the other? And it turned out, of course, to be nothing. And look at look at how, you can buy CBD anywhere now. Similarly, today, I am seeing more and more doctors and really serious treatment places use micro dosing to help out, whether it's depression or anxiety, PTSD, and pain, as a matter of fact, as well. Let's jump in a little bit to some things that I know that you have expertise in, like ketamine for depression. Maybe it's psilocybin or anything else, and paint me a little bit of a picture of what I see right here in your, as we introduce you, natural alternative psychiatry.
Well, the easiest way to understand that is medicine is not above fashion. It's not above what the public believes, what the public demands. I am old enough to remember the 60s, when a lot of people were talking about hallucinogens. And we largely disregarded hallucinogens in medicine. And we thought there was a war on drugs and one doesn't take such things. And now we know a great deal more thanks to some very dedicated people who have been working continually since then. I literally just recently finished reading a very serious textbook of psychedelic medicine. And psychedelic medicine exists for a few people in universities who have managed somehow to get permission from the government to take substances that generally would not be allowed and to study them. And the bottom line is the reason that now I'm devoting myself so completely to this field is that the truth of the matter is it looks as if, as a group, so-called psychedelic drugs or hallucinogens can lift depression faster than any of the FDA-approved drugs. And instead of talking about 30, 40, 50% getting better at the end of 4 or 5 weeks, we're talking about figures more around 70 or 80% feeling something good and not depressed after an initial exposure of several hours. It seems incredible.
That does seem incredible.
But we also know that it's not durable after the first exposure. It's not quite the same thing as having an implicit contract with an unknown drug company to take something every day for, they used to think it works 8 to 10 months when someone's depressed, that's how long it's supposed to stay depressed. But some people end up taking them for life.
Right.
Also, to get maximum effect, people have to work with some kind of therapy. A therapy which is not just the interpersonal relationship, the relationship with someone who knows and can tell you, but it's more than that. It's structured in changing how you think. And suddenly the ideas of psychedelic medicine have put this all together.
So how is it that, and I know one of the things I want to get more deeply into is ketamine. What is actually happening that the results are so much different using these, using psychedelics and stuff than using regular, more traditional antidepressants?
Well, because of a marvelous fluke, we have more access to ketamine. I can't just run out and prescribe someone something that's against the law. My medical license is too precious for me to do that. But ketamine, it is a marvelous and wonderful fluke that happened. It started that a researcher for a drug company discovered in 1962 that you could make from PCP, yes, angel dust, that hallucinogen would cause people to have terrible reactions, ketamine. And then ketamine was not only FDA approved since soon after, but recently the World Health Organization declared it an essential drug.
Wow. Ketamine is an essential drug?
Yes, but it's an essential drug for anesthesiology.
Yeah. That's what it's primarily used as anesthesiology, right?
Not primarily anymore, because a lot of people have discovered ketamine for psychiatry, but it's used at very, very low doses in psychiatry and in very high doses for anesthesiology. It's the drug of choice for several kinds of surgical interventions. It tends to slightly raise the blood pressure when you put someone to sleep. And usually there's a danger of going into shock or becoming seriously ill when someone first gets put to sleep. It does what's called dissociative anesthesia, and that's another phenomenon besides it being put to sleep. It's a phenomenon that's more like a hallucinogen. People have what's called an emergence reaction and report incredible, wonderful sensations, as if they were floating in the air above themselves and looking down upon themselves and observing.
Now, they're aware However, even while they're experiencing this, they are aware that they're having a trip. Is that not right?
It's difficult to answer. Some people get very frightened. Some people think it's real. It's difficult, but it is a different perspective. But the thing that struck me from the very beginning, people say that these moments are among the happiest and most wondrous in their lives.
Hmm.
So I try to figure out what's going on, and they report a sense of oneness with all humanity, something almost divine. These drugs, including marijuana, a lot of things that we considered as not legal, not appropriate drugs, these things are called entheogens. People have something that's like a universal religious experience. And it sounds remarkably as if it's what people in other cultures have been working towards for hundreds, even thousands of years in their cultures. This particular experience, it's almost as if Oriental cultures, or those who we consider mystic, have been working toward it without drugs. And God bless us, in America and the West, we've been working towards more technology, more attempting to understand molecules in the body, attempting to understand the molecules in the brain, and yet we just can't precisely say exactly which ones are doing this to people.
What do we
But,
think it's doing in the brain? What is it doing from a higher level type of a thing? What do we think that it's doing?
well, most of us operate most days on a sort of almost unconscious almost unconsciousness of our daily reality. We do things automatic. I get my microphone and get my phone, and I know I'm supposed to talk, and I keep talking. These are things that you don't have to think about every minute. But when you have an emergence reaction, as are described with the other hallucinogens, and as we know because ketamine is available and can be used, all of a sudden there's a sense of wellness, oneness with the universe, to which there seems to be something neurological. We can't describe it in terms of one receptor to one receptor. We thought before, for example, treating depression, serotonin reuptake inhibitors, most drugs created would stop serotonin from breaking down. Natural substances could turn into serotonin. And now we know enough about the brain to know the serotonin is controlled by something else. There are all sorts of complex letters and numbers. NMDA, memantine. I had thought it was a minor receptor, and I had worked with and understood a little about the people who thought it might help dementia. But now we know that if that receptor is stopped, if it's antagonized, if it's withheld, then there is a sensitivity of memantine to the AMDA receptor. And that somehow seems to be associated with this emergence reaction, with this increased consciousness.
And the net result is 70% of the people, is that what you had said? 70%?
Approximately 70%. Now, it varies among different studies, lots of folks who studied it. But I would say at least 60 to 70% most of the time, they wake up after the experience feeling better, but after the first time they've been exposed to low dose ketamine.
So it is safe, I assume, right? It is safe because it's a low dose.
Yes. That's the short answer. People watch very carefully. I think patients should be screened. You don't want someone who's got uncontrolled blood pressure. You don't want someone who's got narrow angle glaucoma because the pressure will go up in their eyes. But if you screen people properly, and you monitor them properly, at least, even if things are stable, every 15 minutes, look at how much is oxygen is in their blood, how their blood pressure is doing, their
Yeah.
breathing rate, their heart rate. So if you watch them very closely and intelligently, it is a very safe drug.
What does it do for PTSD as well? Is that this? It's because it's really not the same thing as depression.
PTSD very often co-occurs with depression, but PTSD, from the external description, there are a series of things that one would have to have for qualify for it. There is a traumatic event, and at first we thought it was just serious ones like wartime, but a traumatic event can be someone said something horrible that switched on something in your brain. But what happens after that traumatic event? You avoid things that remind you of it. You have perhaps nightmares, perhaps thoughts during the day that interrupt your thought processes. You are what's called hyper-aroused. Sometimes you get the feeling you just can't relax at all because you're abnormally sensitive, perhaps to sight or sound. So it is a whole constellation of symptoms. And yet it seems somehow amenable to the same group of receptors. And these are studied in detail in the animals for obvious reasons, much less in the humans. We like humans and enough to spare them as much as we can. But this can get better with that special kind of illuminating experience.
How
Some
about
of it better. No, just an interesting aside, a drug that had been used for high blood pressure, prazosin, mini-press, was found out a while ago to stop the nightmares from PTSD.
Oh wow, amazing! Another mistaken.
Surprise! For
Right.
psychopharmacology, I labor years to memorize all the molecules, and then we find out it only advances when we get surprises.
That's amazing. Now, what about other micro dosing like psilocybin? Or I know that there's some states that are doing that now too for depression, I think as well.
It seems to work with a slightly larger initial dose and then maintenance doses for depression. But of course, I live in the great state of California where I can't prescribe it, and I am a very good little girl. I don't do illegal things. Not ever.
Yeah, so there's a few other places I think that do it. Do you think that I'm wrong that this is the future though of I'm seeing treatment centers use things like ketamine now in their addiction process, kind of giving people, I call it the moment of clarity, which might last a couple of weeks or something like that. Am I wrong in saying that? I think that it looks to me like microdosing is the kind of the new frontier in this.
It looks like that's the case, but it took me a long time to realize it. I mean, I have spent a fair portion of my life doing clinical trials on drugs, going for FDA approval, presenting them. I didn't believe it at first, but now as I look back over the data and I look at what can currently be done in other places, this seems to be the most productive, the most efficient. I don't want people to suffer 1 minute and they have to, because I mean, depression, it used to be called melancholia in English. People have been suffering for this for thousands of years,
Right.
hundreds of years. And now we can do something that seems pretty safe, pretty efficient, and works pretty quickly. I think this would be immoral, inappropriate. Heck, I took the Hippocratic Oath. That's very long and old and ancient tradition, starts with 400 BC. And you swear when you take the Hippocratic Oath that I will remain abreast of all the changes that
Oh
happen in
wow.
medicine. and bring them to my patients. So the fact that it took me a while to figure out does not mean I should withhold it from them.
Really, really good stuff. How, doctor, how can people connect with you? How can they get back to you? What's the best way?
Okay, I love email. Even though
Okay,
I'm not a
we can have them
techie,
send you an email.
I'll admit to an addiction to email. My initials, ETGMD, Estelle Toby. I love it comes from the Hebrew Tova, which means good. So if there's a bad Estelle somewhere, it's not me. Estelle Toby Goldstein, Goldstein, but just ETGMD, and of course, MD, me doctor. ETGMD at yahoo.com. Everyone knows Yahoo.
Yeah, everybody knows Yahoo. Well, terrific.
No, I have to tell you one other way to get in touch with me.
Yes.
If people like to text me, I can accept text by phone at one of my many phone numbers.
Okay.
Area code 619. That's San Diego region where I practiced for a bit. 940.
Yeah.
6563.
Terrific. We'll have all of that. We'll have all of that in the interview here. And
oh, that's great, because I love to respond to people, and whoever's out there, if you're human, you're one of my peeps. If you're human, I don't think you should be suffering, and that's why I'm here.
No, it's terrible. It's really, really terrible. And it seems like there's no end to it. And I have a real passion for people that that are suffering depression. And it's really a hell on earth. So anything at all that will help people to get out of it, to live happy, successful lives, I'm for. And I did not know that the Hippocratic Oath actually required you to actually continue to learn about new things that are coming out, or new discoveries, or new breakthroughs, because I think that's kind of the essence of science itself, is to find new things, new ways of doing things. So I think what you're doing is really cool. We're going to champion things like this. We're going to actually spotlight it more. And again, there's not one path, I don't think, to living a happy, successful, sober life. I don't think there's one way. However you get there is however you get there. And that's what we want to do.
It's wonderful what you're saying. And I want only to add one last thing. Recovering people are precious. You have been, all the recovering people who may be listening, you have been closer to death than other people that I know. And you've come back and somehow integrated the value of human life on earth. And God, whatever power, may bless and keep all of you for this. If you're depressed, if you're not depressed, if you have post-acute withdrawal from drugs, and that can last 15, 20 years, God knows what. Whatever it takes for your brain and your body to recover from this place you've been, whatever name tag they put on it, depression, PTSD, there are ways out, and it is my honor to be a person who can be involved in helping recovered people find them.
I agree. I think recovered people are the very, very best. Well, that is a great spot to stick the landing, to drop the landing gear, and to bring it in. Really, really enjoyed chatting with you, Doctor. And I'm looking forward to seeing more of what you're doing as you go forward.
My honor and pleasure to talk with you, Rob. God bless, and whatever you believe in, God bless and keep you and all of you at recovery, because recovery is not just the individuals, it is the culture. And I love the idea that you are supporting and helping each other.
Thank you. Thank you.
Onward and upward.
Thank you, thank you, thank you. Well, this is another exclusive interview with Recovery Today magazine, and this is a wrap. Hang on one second, doctor.